So I think we'll get started. It's 1:05. Good afternoon, everyone. My name is Kay Mosier-McDivitt. I'm a technical assistant specialist with the National Alliance to End Homelessness. So I want to welcome all of the New Haven, Connecticut folks that are on the webinar today. The webinar we're going to be doing today is a brief version of the day-long rapid rehousing clinics that the Connecticut Coalition to End Homelessness sponsored back in April, and I was up in your lovely state for several days during the month of April, providing the clinics across the state. But now today, in the essence of time, we're going to spend some time focusing on how to use the rapid rehousing approach, particularly when working with singles and families who present with high housing barriers, particularly in response to the work that you're doing in New Haven with your Rapid Results Initiative and working with those highly vulnerable populations and thinking about how you can use rapid rehousing as a strategy for that. So before we get started, I want to just go through a few housekeeping issues, and now I push the button in my screen. There we go. So today's webinar is going to be for 2 hours. During this first hour, we're going to have everyone on mute, and I'm going to cover the presentation materials. However, during that time, if you have a question, you can submit them in the question panel. You'll see that there's a panel on your toolbar that looks like this, and you just type your questions in and then push send. I have two colleagues that are on the phone with me. My colleague Stuart Campbell is going to be facilitating the question and answer dialogue during the second hour of this webinar, and then my colleague Anna Blasco, who's with the Center for Capacity Building, is also on the call. And depending on what your question is, I mean, even if there's a question about not being able to see something or hear something, Anna is on and can respond to those types of questions. Again, your answer could be typed back. But then Stuart's going to be monitoring questions that come in about the content, and then at the end of my presentation time, we'll open it up for reviewing some of those questions. So, for those of you who may not be familiar with the Alliance, we're a nonprofit, nonpartisan organization committed to preventing and ending homelessness across the country. And then I work in the Alliance's Center for Capacity Building, and the work we do is working in communities, providing folks with tools and technical assistance across the country to help implement best practice strategies and solutions to reduce homelessness. So on the next slide, you're going to see the agenda. So the first thing we're going to do is an overview of rapid rehousing, and then talk and look at some communities that have specifically rapidly rehoused high barrier households and what we've learned. Then we're going to review the core components of rapid rehousing very briefly, and talk a little bit about how you think about those components in light of working with folks with high housing barriers, and just a little bit on program design, and then a question and answer time period. So I also want to recognize that this is a Greater New Haven Rapid Rehousing Training, and this is in response to the initiative that you guys are working on, and I know that a number of you from the leadership group are together listening to this webinar, as well as some other providers that have joined. And just to thank the Connecticut Coalition to End Homelessness and the United Way of Greater New Haven for sponsoring this webinar. So let's get started now with a rapid rehousing overview. So this definition of rapid rehousing comes from the Emergency Solutions Grant Interim Rule that came out in December of 2011, and that rule is still in effect, even though it's the interim rule. Until the final rule is published, everything is under the interim rule, and the Continuum of Care interim rule is basically a very similar definition, so we just use this one. But when you look at what is rapid rehousing, it's got some basic core component services, and we're going to talk about those later, but it's the provision of housing, relocation, and stabilization services, and short or medium-term rental assistance as necessary to help a homeless individual or family move as quickly as possible into permanent housing and achieve stability in that housing. So what does this really mean? So when I work with communities, I often find that folks use a term, a rapid rehousing program specific to a funding source. Somebody gets some ESG dollars and then they operate a rapid rehousing program as part of what, whatever else they might be doing. And it tends to be specific just to, a resource, and when the money runs out, then we're done doing this thing called rapid rehousing. But in practice, I'm finding that often folks are really missing the actual rapid rehousing approach. So one of the things that when people were saying, well, exactly what should a program look like? And this is not about a program. Rapid rehousing is a strategy, an approach that is focused on quickly ending someone's homelessness. And in the practice, you need to do what is necessary to make rapid rehousing happen. So I looked at the definition for rapid, and it says it's an adjective meaning moving or acting or occurring at great speed, and rehousing means providing someone with new housing. So that pretty much sums it up, right? So we need to be rapidly rehousing folks with great speed. We need to be finding housing with great speed, and then with a housing first approach, not requiring that they had to meet a certain threshold or eligibility requirement before they're housed, but rather it happens quickly. When somebody has that episode of homelessness, that crisis of homelessness, how do we rapidly get them into stable permanent housing? So if you're housing someone 3 to 6 months after they become homeless, that's not rapid at all, and that's really not what the strategy of rapid rehousing is meant to be. So why rapid rehousing? So I'm also going to tell you that I stole this slide from Marge Worley. She's with Apt Associates, and in a presentation she did on the basics of rapid rehousing in New Orleans this spring in February. This was one of the slides in her presentation, and it just really resonated with so many folks that I thought I would use it, and she said that we could do that. So first of all, we need to talk about housing first. And housing first is that we need to house people immediately. They deserve housing first without any preconditions. So a lot of times, again, folks say, well, yeah, we're a housing first community, but what we find is that we really still are not embracing that approach that the first thing we do is house people. We don't look at, income. We don't look at mental health or substance use, but we're housing people first, and then we start working on those things. And that's the rationale behind rapid rehousing. Rapid rehousing is a strategy by which we become a housing first community. And then if you look at Maslow's hierarchy of needs, it states that survival and safety needs drive behaviors until these needs are met. And one of the basic survival and safety needs is having permanent housing stability. Once people can be in permanent housing, then they can focus on their other higher needs. So in fact, when you think about how we have historically looked at this, it was, we want our folks to create long-range goals, long-range plans, to, get ready to move into housing. But in fact, when you're in a situation of instability, whether you're on the streets, in emergency shelter, or even in transitional housing, it's temporary. The crisis is not over. You're still in this temporary state of housing, and it's very difficult for folks to really focus on those higher long-term needs. So thinking about rapid rehousing, we make that basic need of housing first, and then folks can start focusing on their other higher needs. And then there's the crisis and stress biology that probably we can all somewhat relate to, and that is that there's these neurohormones that are released when we're experiencing stress, and then we sort of unconsciously just think in the moment and can only deal with like the here and now. We look at the short-term rewards. So this prefrontal cortex, which is responsible for the long-term planning, is overridden. And homelessness is a straight state of crisis. I think that if we think for any of us, if we would end up homeless and losing our housing, we would be in a state of crisis. And so, we're not going to be folks that are in that state of crisis are not able to think long-term. So until folks are housed, they really can't focus on addressing the barriers that interfere with their ability to get housing on their own, like their ability to access or increase their income or jobs, or address their mental health and substance abuse issues. Instead, they're really focusing on these immediate crises and not these long-term planning solutions that historically we've had as part of our case management planning prior to housing placement. So, and then I think the last thing to talk about is the results of rapid rehousing. So it's really important to recognize the systemic impact that communities that have really strategically adopted rapid rehousing approaches have seen. So I'm going to, and I'm going to talk about Hennepin County later, but Hennepin County, Minnesota, which is the area that Minneapolis is in. A number of years ago, back in the late 1990s, they experienced a real surge of families experiencing homelessness. And so in light of limited shelter space, what they decided, they looked at the length of time folks were spending, the families were spending in the shelter system, and they decided that they were going to really look at reducing the length of shelter because they could see that that was going to free up crisis beds for others in need. And that was when they first adopted the rapid rehousing approach. And between 2000 and 2004, they actually saw the point in time, not only did they not need more shelter beds, and while more families were becoming homeless, they actually decreased their point in time count by 42% for families, and that's because they were reducing this length of shelter stay, freeing up these crisis beds, so when somebody else had a crisis, they didn't need to get on a waiting list or stay in the streets, but instead there was a place they could go for the crisis, and then that family or household or a single person could get quickly connected with housing. I think one of the other things that's really important to note is that the longer somebody is homeless, the harder it is for them to leave homelessness. There's long-term negative impacts that go with long-term homelessness. You know, the longer you're without housing, the harder it is to have a housing history. The longer you live in the streets, the harder it is to maintain sobriety, your mental health stability, and all of that. We also know that the longer persons are homeless, the more likely they are to return to homelessness after they are housed in permanent housing. So the quicker we can end an episode of homelessness through a rapid rehousing approach, we're going to reduce the negative impacts of homelessness and reduce recidivism. And then ultimately we know it improves household outcomes across all populations. Everything we've seen has shown improved household outcomes once folks get in housing and are rapidly rehoused. And we'll talk more about that in a little bit. So, is rapid rehousing for everyone? I hesitated for a moment to let you think about that. So here's the theory of why we think you need to be trying rapid rehousing interventions with everyone, regardless of their risk barriers. First of all, it's really difficult for us at the front door to tell who's going to be successful and who won't be successful. Housing barriers alone do not indicate long-term success. Secondly, there's no assessment for client resiliency, and I think we'll all agree that living on the streets, folks that are chronically homeless, long-term homelessness, have an amazing sense of resiliency. They have tenacity. I mean, just to survive in the street takes incredible resourcefulness, resiliency, and tenacity. And so sometimes taking those skills that it takes to survive in the street are the very same skills that can kick in to help people maintain their housing and become stabilized in housing once given that opportunity, and using all of that resiliency and tenacity to focus now on the long-term goals, because now they aren't living in that state of housing crisis and homelessness anymore. And nobody's been quite smart enough to figure this out yet, so folks that have often been screened out of rapid rehousing, when it's been tried with them later, it's been found to be very successful. So let's start with this and see if it works, because in most cases it does. One of the things that is very important is that, you know, if you're going to rapidly rehouse everyone, you need program flexibility. This cannot be a one-size-fits-all. Is going to get, you know, security deposit and 1 or 2 months rent and maybe a month or two and you're closed. Next case, when you're looking at a strategy for rapid rehousing that's system-wide, it's about meeting every household where they're at. Some folks are going to need very short-term assistance. Some are going to need some maybe more moderate, maybe 3 to 6 months of case management and financial assistance, and someone may need more than that. But because we can't tell at the front door who's going to be successful and who won't, and we can't assess for that resiliency or resourcefulness that can happen when somebody's housed, you know, a needs assessment before somebody's housed, you know, often doesn't exist anymore once they're in housing, because a lot of those needs go away the minute somebody gets into housing. And then, and this sort of folds into this concept of progressive engagement. So progressive engagement is a strategy by which you start with everybody at the front door gets the same amount of assistance, not the same amount, but a shallow amount of assistance. We start with the least amount necessary, both on case management side and financial side, to start with that household. Say we like over 3 months. So we're going to start by giving, you know, on a month-to-month basis, that rental assistance and just a few case management visits. And then by meeting with the families, we start determining who's doing okay with that really shallow assistance and who seems to be a little bit more. And then after 3 months, we do an assessment and sort of go, okay, these households now, they're okay. They're going to be okay. We're going to step out and close those households, but these other group of households need a little bit more. So, you know, what we find that folks that do progressive engagement find that about between maybe 60 and 70% of households only need a shallower subsidy. But then that next group needs a little bit more, and out of that group that's left, about 50% of those need between 6 to 9 months of assistance. And after that group is stabilized and there's still some folks left that, you know, at the end, it, you know, comes down to usually only about 8 to 10% of the people that were rapidly rehoused, or of the group that's left, are actually going to need some long-term intervention. I think the really interesting thing, and I'm going to talk about this a little later with Salt Lake City, is that communities that have done this have found that had they used that assessment at the front door, the folks at the end that need the deeper subsidy don't look like the folks at the front door that would have been screened for that subsidy. A few of them do, but not the full group. So moving on to talk a little bit more now about how do we know rapid rehousing works. So the next several slides come from some data that was some congregate data that was put together from 14 continuums across 7 states across the country that participated in the Alliance's hearth clinics, which we also call performance improvement clinics, and some of these were, from areas included Balance of State. I can't say all of them off the top of my head, but I know Iowa Balance of State was included. The whole state of Delaware was included. Lancaster County, Pennsylvania was included in this. Alameda County, California was included on this. Orange County, California, Sacramento, 2 rural areas from the state of Washington, and a few more. But saying that, because we came from, I think maybe Mississippi, so from some very low housing cost areas to housing cost areas in California that are at the top of the scale. And the interesting thing is that when we looked at the data from all of those communities, and while this is aggregate data, and pulled all of the data into one chart, the trends were still the same across the communities, regardless of the community, regardless of, you know, the housing stock, the housing costs, the homeless populations. There was just similarities we found no matter where we went. So this first slide is the average rate of exits to permanent housing. And this side is singles, and this side is families. So we used data from communities that had at least 85% of all of their providers for all strategies participating and putting data into their HMIS system. And these were communities that also data was being entered on, you know, in a very timely manner, so it was current data. We worked with a lot more communities than these 14 continuums, but these were the ones that had data that could really show what was happening in their system because they had enough data to do that. So this included data from high performers, from low performers, from faith-based performers like missions and Salvation Armies that may not get the public funding, to ESG providers, continuum of care providers. It was like all of the providers in the system in those continuums of care had their data. So here's what we found, is that when looking at singles, those exiting, the exits to permanent housing from shelters is only 16% of singles were exiting to permanent housing out of the shelter system, emergency shelter. When we looked at singles that were in transitional housing, only 42% were exiting to permanent housing. And then when we looked at singles served in rapid rehousing, 75% were exiting to permanent housing. So I know, you know, you might be thinking, well, of course, because that's what rapid rehousing is. We're exiting everybody to permanent housing. Why is that not 100%? Well, this is about not when people exited from shelter to permanent housing. This is when people exited the Rapid ReHousing program. Their subsidy was gone, their case management was done. It was when they were close to services. So, in some cases, this goes back to what I talked about before. It might be 3 months after entering the program and be in housing. For some folks, this was 6 months later, a year later. But when they exited the program, they're getting no more subsidy. They're getting no more services. How many were in permanent housing? So for singles and rapid rehousing, it was 75%. Clearly a significant improvement over the other two strategies. And when we looked at families, we saw the similar, and each one was a bit higher, but nonetheless still a similar trend, where 32% from shelter were exiting to permanent housing, 55% of families from transitional housing, and 85% from rapid rehousing. And I know that, if there's folks on the call that might be a shelter or a transitional housing program, you may have exit rates that are higher than this, and of course that's true. Remember, this was averages, and I said that high performers and low performers were included in this, so there were a lot of these communities that had tons of programs. For example, Alameda, California, I think has almost 20 transitional housing programs, so they have this, so this covered every single program. So there's some programs that, exceed these results and some that were well below them, which brought the averages down. But it was the same in rapid rehousing. There were some rapid rehousing programs that did not have as high of outcomes, and there were others that had even higher outcomes. But when you looked at the averages, rapid rehousing has better outcomes for permanent housing than any of the other strategies that we've historically used. And then people will often say, yeah, but, when we're rapidly housing people, don't they end up becoming homeless more quickly? And, we're setting up to fail because they're just going to come right back to the system. And when we looked at that for singles and for families with children, we found that, in fact, that wasn't the case. So even though only 16% of singles moved to permanent housing, out of that 16%, 15% of them came back to the shelter within a year. And out of the 42% of singles that moved to permanent housing for transitional housing, 7% of that 42% were back in the system within a year. In rapid rehousing, there was a little bit higher recidivism for singles. It was 9%, but remember that 75% of singles were in permanent housing. So what that means is there were still a ton more singles that stayed out of the system than what returned from the other strategies, because more people were successfully exited into permanent housing. For families with children, we can see that it comes down. Shelters, 11% recidivism rate, 9% for families, and 4% for children. Again, the rapid rehousing was measured 1 year after program exit, not after exit from the shelter through rapid rehousing, but a year after they were closed to the program. And I think one of the more significant things, well, maybe not more significant, but also very important, is looking at what is this costing us? What are each of these strategies costing us? So what you're going to see is on the right side of the screen is what the cost was for all exits from shelter, from the strategies. This is shelter, transitional housing, and rapid rehousing. So whether somebody moved to permanent housing or whether they were exited back into homelessness and did not have a successful exit. And remember, only 16% of folks here had a successful exit, and it still cost us $1,285 for every single person. Even those over 80% of folks that did not have a permanent housing exit were still costing the system almost $1,300. And when we look at the same thing with the transitional housing at a cost of $7,600. So remember, over half of the people did not exit to permanent housing. So even for those folks that did not exit, it cost us $7,600, and they did not have a positive outcome. When we look at rapid rehousing, the cost was almost, like about half of what the cost was for transitional housing, which was $4,288. But when we looked at the permanent housing exits, which is what really matters, we can see even a much more impactful difference. And so when we look at transitional housing to rapid rehousing, we can see that if we had used a rapid rehousing strategy with these singles, that we could have served 3 times more households for the same amount of money. And remember, when we look at the exit data, we would have more positive exits and less recidivism. And the same for families. And across the board, what's really interesting that we just found out is that for some reason it seems like the cost for families is slightly less than the cost for singles. And one of the, again, there's not any deep research that goes into this, but from what we understand from these communities, that often singles had higher housing barriers or were being housed, with Rapid ReHousing money, so they may have gotten a few more months of subsidy or case management services. Here's what I want to talk about. This is not these dollars on both slides. This is not the amount of financial assistance that was provided to each household. This is the total program cost. So this includes the financial assistance plus the cost of staff salaries, plus the cost of administrative salaries, plus the space cost and office space for everyone, and the administrative and the overhead. This was the full cost to operate the program, the same as this is the full cost to operate a transitional housing program or an emergency shelter. So again, there's some real value in thinking about how shifting to rapid rehousing strategies can help us have a lot more outcomes for our populations for the limited resources that we have in our community. So I know, see, I have to go to my notes now because I've lost my place in my notes. So I know that a lot of you have, I'm assuming, seen the results from the Connecticut study on recidivism that was done and released recently, and also the New London study that showed that when, you know, with rapid rehousing, shortened length of stays happened, and then capacity was also increased in the shelter because we were freeing up beds, which is that stuff I talked about earlier about the results of rapid rehousing. So I'm not going to share those slides today in the essence of time, but I'm going to share some information from other communities that support the same information that the Connecticut studies have shown. So this is a 2013 Georgia study on recidivism that came out in October of last year. And they looked at recidivism rates, and what they discovered in looking at, and this was the entire state, all recidivism was looked at across the entire state, that persons that were exiting from emergency shelter and transitional housing were at least 4 times more likely to become homeless again than persons that exited from rapid rehousing program. In addition, they also found that persons with a history of homelessness were 2.5 times more likely to become homeless again. So one of the conclusions they drew from this is that, you know, once we, you know, permanently house people, whether, you know, out of any strategy, but particularly with rapid rehousing, if, you know, after, you know, 6 months or a year they struggle, it makes sense to help them to stay in that housing and not become homeless again, because once you become homeless again, you know, the more episodes of homelessness you are to continue to come back into the system. And finally, they also found that persons that were temporarily housed after program entry, after they came into the shelter system and were put into a temporary housing like transitional housing, those persons were 2 times more likely to return than those who were permanently housed with rapid rehousing. So the next communities I'm going to talk about is going to be focused more on some of the communities and data that looks more at those that worked with high housing barriers, those with that had more high risks for housing, for finding housing. So I think the National Center on Homelessness Among Veterans recently completed a study looking at the results of those rapidly rehoused with SSV funds. And this study has, and this was actually, I think, just released in April of this year. And this study is some of the most recent data, and also has shows some of the most impact of the positive outcomes of rapid rehousing by looking at the SSVF, those that were rapidly rehoused under SSVF. So this slide is an SSVF, which is Supportive Services for Veteran Families, for those of you who may not know, which is it provides both rapid rehousing and prevention dollars for veteran families, veteran households, and so this data is specifically for veteran families that were served with rapid rehousing under SSVF. And in comparison with the GPD, which is a grants per diem program, which is a transitional housing program heavy in supportive services, and it's a 2-year program. And they looked at the difference in recidivism rates for individuals that exited the 2-year grants per diem programs. The group used for this study were those that scored higher, that had higher risk factors, and then they were targeted to this longer, deeper 2-year service-intensive program because of showing that higher need. And then what researchers did is they took a matched comparison group that had the exact same risk factors that looked exactly the same as those folks that were in the GPD program, but that because of not having availability in the GPD program, were instead provided rapid rehousing through SSVF. And they measured the recidivism rate at 1 year and then at 18 months post the permanent housing exit. And what they found was that significantly more people that had been in this long-term deep service housing readiness program of GPD had a high, almost over a third of those folks in that program were back in the homeless system within a year, while that very same match comparison population where everything else was the same, all of their risk factors, all of their, including age and mental health and substance abuse and incomes, all of that were the same. In the SSVF program, there was a recidivism rate of 11%, which means that 1 out of 10 was coming back in the system, but 9 out of 10 were still housed a year later. And then when they looked at 18 months, what they found is that those in SSVF, there was very little change. It only went up by another % over the next 6 months, which in some, leads to saying that, the longer people are housed and they're in their stable housing and quickly housed, then that chance of them going back into homelessness again actually decreases. And while it decreased here, it still, by the time 18 months went by, 41%, which is really getting close to half of people that had already spent 2 years in a program, got lots of services, and now were permanently housed within 18 months, 41% were moving back into the homeless system. So the other piece that I want to look at this, some other data that they included were the exit outcomes based on the income levels for veterans and these veteran households that were rapidly rehoused. So they looked at those with no income, and you can see across the bottom, no income to those that had 2,000 plus. And so while the permanent housing exit rates was a little bit lower, we're 73% here, and we're at 86% with those with incomes of more than $2,000. I think the really interesting thing is that you would expect to see a huge difference and thinking, well, if folks have no income, there's no way that they're going to be able to stay in permanent housing after the program ends, once the subsidy goes away. And in fact, 73% were able to stay in permanent housing. And you would expect that people with over $2,000 of income, you would expect to think, well, those people shouldn't have any problem. I mean, that should cover their costs and they should be doing fine. And yet, while they had a higher rate, still 14% did not maintain their housing. They had non-permanent housing exits. Now, the interesting thing about this is that the study found that most who did not stay in the permanent housing exit did actually not come back into homelessness. So most of these folks were not coming back into homelessness, but they were actually going and moving to another temporary living situation, but they were not re-entering the shelter system. And in fact, less than 2% of all folks, of all of those assisted with SSVF exited to homelessness. So only 2% of all of this, all of these folks exited to homelessness. So I think one of the other things I want to say is that these were people who exited from the program with no long-term subsidy. So even coming into the program with no income, 73% maintained their housing, were in permanent housing without a permanent housing, a permanent subsidy. The short-term subsidy left, and they were paying full market rate for their housing at the end. So when they came in with no income, by getting the services they needed, they were able to find the income they needed to keep their housing at 73%. I also want to say, when you think about it, so if these are the groups, this group particularly, and maybe even this group and this group, if we would be saying, well, there's no way we can house these people, they just don't have enough income. And so instead they stay on the streets in a shelter bed for a long time waiting for that permanent housing, permanent supportive housing or VASH voucher to come open. We have people that were homeless. So say there's 100 in each of these, right? These groups. And look at the fact that if we had just tried rapid rehousing with that group, that historically we've kept on waiting lists, waiting for something to come along, that in fact 73, and 76 people out of 100 in each category, if we use that simple number, would have actually no longer been homeless instead of sitting on a waiting list somewhere waiting for their name to come up. One more reason why we really need to try rapid rehousing for everyone. So I want to talk a little bit about Alameda County. I referred to them earlier as being part of the other data that you saw, but one of the things that Alameda decided to do when HPRP came out, they put together a task force to really start the dialogue about expanding the rapid rehousing approach to high housing barrier households. So the key drivers in making this decision included, best practice research and also looking at data on outcomes for their current system. And then, with the influx of dollars that HPRP brought, they just made this decision, let's seize this opportunity to really look at some system change. And as Elaine DeColony says from, I always say her name wrong, Elaine DeColony says from Alameda, is that probably the most important decision they made was to serve high-risk households, building on the lessons they learned with the lower-risk households. So they actually went into this decision expecting that that the rate of success might be lower and the cost higher for those with the high housing risk, but they decided that it was worth it for those that were still successful in ending their homelessness. And what they discovered was that, in fact, serving higher risk households did not result in higher costs. So just to explain what you're seeing here, the way their assessment score worked, and this is different from the SPDAT, which I know you guys use, is that the higher the score meant the lower barriers. You got higher numbers for having low barriers. So if you had an income, for example, you'd get I don't know what it was, but you'd get a 10, or if you had no income, you got a 0. So a high score meant that you had low barriers, and the low score meant that you were the high housing risks. You had a lot of high barriers to housing. So what they discovered is while the low scores had a little bit longer time in the program, the amount of assistance that was provided was not different, and in fact was even slightly less for the higher barrier households. The access to permanent housing was exactly the same, and in Alameda they did have some subsidies, permanent subsidies for some folks, but in fact out of all these exits, only a third, and just slightly more over here of both categories, there was not a significant difference between the low scores and the low barriers and the high barrier folks in terms of getting a permanent exit and still having a success rate. Both were 98%, and only a few more folks that had high barriers got a subsidy than did the others. And then the other thing they wanted to look at is across their system, they looked at all of their returns to homelessness, because the concern was we may have these access to permanent housing, but are we finding folks coming back into the system more often? And they found that, in fact, less than 3% of folks rapidly rehoused with HPRP dollars returned to homelessness, which was less than the 7% from transitional housing and the 24% from shelters. So this is what drove their process and their change, is seeing that it didn't, they stopped screening people out and taking people from all risk barriers in their program. Another community was the Hennepin County, Minnesota, and I talked about them before in terms of the strategy they used to make sure that they didn't need to open new shelter beds. So as I said, back in between 2000 and 2004, Hennepin had created and a locally funded, and I think it was before people were using the term rapid rehousing, but this sort of housing first family housing program, which was really one of the predecessors of the current rapid rehousing. So when HPRP came along, they decided, okay, we're already housing those, and they had a scale of 1 to 5, and the people, again, theirs was the opposite way, where the lower the score was the lower the barriers. So people that were 1s, 2s, and 3s were the low to moderate barrier folks, and they were already rapidly rehousing all those folks with local dollars. And then HPRP came along, and they were already housing that other population, so they decided, well, let's just start housing every single family. They took the 4s and the 5s, the highest, those that were being targeted for transitional housing programs and for permanent supportive housing programs. And when they expanded the program and included all those, including housing people with 0 income at the time they housed them, 91% of those families did not return to shelter, to return to homelessness in the first year, and 85% of families were still housed after 2 years and did not become homeless. And one of the things that they did was started to look at those households that did come back, and it wasn't necessarily those initial risk factors that folks were coming back in, but they found that there were maybe some other trends. But they also worked on really coming up with another rapid placement of those families back into housing, so that, because again, to decrease the amount of time that people stay in the shelter, and continuing to find a way to get people out more quickly. So what they realized is that all these households that were previously would have been identified that for deeper, longer, more expensive interventions, like transitional housing or the permanent supportive housing, the majority of them were actually successful with the minimal supports, the shorter-term supports offered in the Rapid ReHousing program. So I mentioned Salt Lake City and this progressive engagement model a little bit ago. So just to talk a little bit more about the progressive engagement model, between October 2009 and January 2013, Salt Lake City and County served over 1,000 families. And what they, one of the things that they decided to do, and sort of we coined the word progressive engagement to describe the model, is that they just discovered that they just were not good at predicting, and no matter what questions they were asking or where people were scoring, they just couldn't predict who would be successful at the front door. So they decided that every family that entered the shelter system at the front door would be connected with Rapid ReHousing. And they would start with just a minimal amount of assistance and case management services for the first 3 months. And I talked about this before, and their study was one of those, or their results were one, where about 70% of families exited successfully after 3 months, including a number of households with high housing barriers that they would have previously screened out. And again, what I talked about before was that out of those that remained in the program, about half of them needed 6 to 9 months of assistance. What they initially found is about 8% of the total needed a deeper intervention, and what they discovered is that the demographics and the risk factors for those families were varied. And what they, so looking at this, what they now found, and so, with those short-term, but also then some of the folks that need the longer-term intervention, that the average length of time in the program is 5 months, and the average amount spent per family is $4,900, which again looks very similar to the Alameda County stuff, because this one just includes this one includes everything, the cost. The total cost and overhead costs and administrative costs and everything in Alameda was just the financial assistance. And so, if you add the overhead costs, their cost probably would have been very similar to this. One of the really, I think, cool things in this is how they reduced the length of stay, that they took the family length of stay went from 71 days for a shelter stay down to 26 days. And over the course of this 4 years, only 13% total have returned to shelter, and half of those were the minute they presented at the front door, they were immediately rehoused, and so they actually did not need to come back into the shelter bed. So finally, we often know that communities are reluctant to try rapid rehousing for persons that score for a deeper intervention, such as VASH, or a permanent supportive housing voucher, because they have a fear that once they've lost their priority as a chronically homeless person, because we're supposed to be prioritizing chronically homeless people for those interventions, that if they lose that status and if rapid rehousing wouldn't work, then they've lost that opportunity for the deeper intervention they needed. So this is actually from the FAQs on the One CPD website. You can see right here is the link where I got this information from. And in the FAQs, the question is asked, is an individual or family that is receiving rapid rehousing assistance considered chronically homeless for the purposes of remaining eligible for permanent housing places dedicated to serving the chronically homeless? I couldn't say that without taking a breath in between. So the answer from the website is yes. Program participants that are receiving rapid rehousing assistance maintain their chronically homeless status for the purpose of eligibility for other permanent housing programs dedicated to serving the chronically homeless. So as long as they're actively participating in the rapid rehousing program, they do not lose their chronic status. If they are exited from the rapid rehousing, closed to services, and then, a year or 2 or 6 months later, they would not have the chronic homeless status, because once they're exited, they're now permanently housed. However, even though they maintain their status as long as they're in the program, they still are no longer considered homeless for the purposes of the point-in-time count, because they're still in permanent housing. But this really then takes us back to that question I asked earlier, why we should try rapid rehousing for everyone? And we said, the answer is yes, because even if persons have no income, and even if they have a slightly higher recidivism rate, the vast majority of those rapidly rehoused with no income and with high housing barriers actually don't become homeless again. And we also know if they do, as long as they're in the rapid rehousing program, they're still, and were chronically homeless before they entered the program, they still are eligible for the deeper intervention if they don't make it. And in essence, this is a progressive engagement model and was really the impetus behind the Salt Lake City approach. So now I'm just going to touch briefly on the core components of rapid rehousing. So the 3 core components of rapid rehousing, and these are the core components that were agreed to with the National Alliance End Homelessness, United States Interagency Council, HUD, the VA. Came together, got around the table, and there's a document that we sent to Sarah that I think she's distributed to everyone that goes over the core components. But what's really great is that for the first time, regardless of funding sources, is that when we're talking rapid rehousing and what should be part of the rapid rehousing approach, this is an agreement that all 3 of these core components need to be part of the program, either provided by the organization administering the rapid rehousing program or in partnership, but it's not rapid rehousing without all 3 of these strategies being part of it. But before I talk about that, I want to talk a little bit about housing barriers. So I think one of the things that we find is that when we look at the path to housing stability, and think of this as a path, it's like a tube, right? But there's sort of 2 levels of barriers. And what we've often found in screening for, housing programs or rapid rehousing programs and other housing is, we have a screening that looks at, well, is this household going to be able to maintain housing? And a lot of questions are focused on somebody's ability to maintain housing. And what we suggest is that what you really need to be doing is just looking at the barriers to obtaining housing, which are those tenant screening barriers. What does a landlord look for? And then the income. Somebody has 0 income. Obviously, the landlord's going to go, well, I'm not sure I want to rent to somebody that has no money. So what is it that landlords care about? And we need to know that stuff, not to screen people out or to make people ineligible for rapid rehousing, but rather this helps us design the program. We need to know this stuff because this is what landlords look for when taking applications, and that we use this to identify the right housing, the right landlord as part of the housing search plan. This second half, and all of this is the stuff we start focusing on once somebody is in their permanent housing. So now once we get the housing, we've overcome the barriers, we've used the subsidy, and the assistance and the case management and housing location to get folks into their housing. And now this critical piece of the rapid rehousing case management focuses on how are people going to maintain their housing? How are they going to, like the things that are going to interfere with their lease compliance and their ability to pay their rent once they're in housing. So continuing on this principle, part of helping clients access housing as quickly as possible also means that we have to remove the program barriers to accessing housing. So again, we also know that there's a lot of programs that require clients to complete maybe a budgeting course or a financial literacy course, which are sort of the same, but before you can be housed, you've got to complete these courses. But in fact, this is really, you've just got to get folks into housing, and then once you're in housing, then completing those courses during that time that you're providing the assistance. So the first 3 to 6 months when you're working with these households, getting those services in place at that point, they're going to be just more effective because people are not going to be in this housing crisis anymore. So the core component, which is the housing identification, and I like to call this the housing search and landlord recruitment strategy. When we go over all of these core components, when I do the one-day rapid rehousing clinics, we actually spend more time on each of these, and we include some activities that can help programs and organizations develop tools and resources to implement and improve these components. But today I only have a chance for a brief overview. I do want to mention before I go into this first core component that on our website we have short modules that cover these core components that can provide you with some additional information and include some of the activities that we use in our in-person clinics. So this housing identification component is really critical because one of the big pieces of Rapid ReHousing is to provide housing search assistance on behalf of the client, and then this whole landlord recruitment strategy to build a pool of landlord resources. So it really takes, this housing identification and what works. It's really about creativity, ingenuity, perseverance to really rapidly rehouse those experiencing homelessness. And housing identification is really critical in making this work. So obviously, and I think I said this before, if folks we're working with could access housing on their own, they would. So we really need to use our Rapid ReHousing resources on helping those that have the greatest barriers, and then working with landlords and identifying like creative housing options and solutions that can work. And I say on here is be bold and be realistic. So being bold means, really selling the program, not being afraid to ask landlords to take somebody that has a poor housing history, or even asking somebody to reduce the rent, or maybe asking, if somebody, somehow they get paid twice a month at certain times, that maybe asking a landlord if they'd be willing to split the rent in half. Just whatever it's going to take for the household to be successful. Really be bold and be creative, but also be realistic, because we also know there's been programs that, because there was a subsidy, the short-term subsidy, people, and sometimes, people would be put in housing with the subsidy, that the reality was that regardless of what their income, would be, even if they got a job, the skill level they had made it unlikely they would ever be able to afford the housing. So you really have to be realistic. And, it doesn't necessarily, mean that everybody has to have, their own apartment, their own bedroom, or this doesn't even mean that housing is not going to be a cost burden, but it's rather about ending their homelessness, the crisis of homelessness, which is so important. And I think you need to think of a number of solutions to make that happen. So I'm going to talk particularly about singles who have been homeless for extended period of times. That actually, I talk about shared housing can be a good solution. Micah Ministries is a program in Fredericksburg, Virginia that was established through the faith community. They started out providing cold weather shelter. They have a year-round drop-in center, and they do outreach to the chronically homeless in their community. So a number of years ago, Micah then decided to apply for and received funding for an 8-unit permanent supportive housing program through the competitive continuum of care process. And so Megan Cotter, who is the executive director there, shared with me that really offered this great opportunity for some of those that they had been working with to get them off the streets. But then, she sort of had an aha moment when she realized, okay, 8 units filled up. Now what do I do with all these other folks that, we keep seeing the same faces again year after year in the cold weather shelter and coming into our drop-in center? So when HPRP came along, it was first, thought that this just needed to be for families, and then there was some additional monies left, and so Megan decided that she was just going to take the opportunity and try to use these dollars with folks that were chronically homeless. And as she said, what did I have to lose? These folks were already living in the streets and had been for extended periods of time, and just getting them off the streets, even for several months, was going to be huge in helping them heal. So they use the HPRP funds, and now they get both state and local ESG funds, and have also done a ton of fundraising to supplement this to rapidly rehouse the chronic population. And shared housing has been an extremely effective strategy. And what she found was that while living on the streets, a lot of these folks were developing their support systems, having sort of a group of people that looked out for each other. And by building on these systems, these support systems, they started really looking at the shared housing opportunities. And so they really worked with landlords and offered ongoing contact and support from their organization. Even after a case was closed, they were able to find housing resources even in a very high housing cost community. This is one of the highest housing cost communities in the fair market rates in Virginia. And they discovered that they have the same success rate with these chronically homeless folks that were rapidly rehoused as they did with their permanent supportive housing program. So within 3 years of starting the rapid rehousing as an intervention for this population, chronic homelessness in Fredericksburg dropped by 42%. So there's a good story, right? But I also want to talk about how important it is to have a good pool of landlords, which is critical to the success of rapid rehousing, and to remember this as an ongoing process. And it's not, you don't just like have somebody that needs housing, then you start calling and trying to find a landlord. This is an ongoing process in rapid rehousing, and this slide talks about diversifying your methods and thinking of all kinds of ways to bring landlords in. I also want to say that diversified methods of outreach really allows you to leverage different household resources to meet the variety of needs of those that you serve. It's really important when working with high housing risk households that you know which landlords in your landlord pool are more flexible. In some cases, maybe there's landlords that really want to give back to the community. They're not in it just for money. And then those are the landlords that you want to keep in sort of that specialized back pocket that are really willing to work with you in accepting high barrier households as tenants. You have to be very strategic when working with folks that have high housing barriers. So the next core component is rent and move-in assistance. So the basic tenets of this, and the most important thing I want to emphasize, is that assistance needs to be flexible and individualized for each household. This cannot be a package deal, a one-size-fits-all, because we're not dealing with households that look the same. And so, we need to create a short-term financial assistance package or program that should be the minimum amount necessary for each household. But what household A gets and household B and household C, when I used to look at files around this stuff back in my previous work, if every plan, if every financial assistance plan looked the same, I knew that that was not a best practice rapid rehousing program. It really was about making what works for each household. And just recognizing there's a diversity of strengths and resources that each household brings to the table, as well as their needs. And so some may only need a short intervention, some may need a longer intervention, but a program has to be flexible. And so, and be able to shift as needed. So there's a lot of different ways folks look at this. Sometimes people use a fixed rate depending on the size of the unit or household, or a declining subsidy, or a percent of income. The one thing I want to just say is if you're looking at a percent of income, that using that 30% of income is probably not the best way to do it, because in fact that feels and looks like Section 8, and the reality is that most poor people pay between 50 to 70% of their income towards housing, and you really need a realistic approach to help households know what the cost burden of their housing is going to be. And when you look at this package, also leverage all types of other resources that somebody may have. Maybe there's a family member that may contribute some towards their housing. Maybe they can barter some services that can help them pay their rent. So just remembering that the subsidy pays for the housing, it does not alleviate poverty. It's about ending the housing crisis. So I want to recognize that I'm almost at an hour, and I have a few more slides to go over, so I'm going to sort of keep moving along, and but we'll still have plenty of time to get to our questions. So the last core component I'm going to talk about is the rapid rehousing case management and services, which I like to call the home-based housing stabilization services. So this last core component is as equally important as the previous components, and I often think about this, that it's really important in working with high barrier households, both as a selling tool to the landlords, because the idea that you're going to do this home-based housing stabilization case management really allows you to be able to give the landlord with these populations something that they might not get with other tenants. It also really helps in connecting folks with resources and the skills they need to maintain their housing. So without those case management follow-up services, folks are not going to be nearly as successful in their stabilization. So what do you need to do? The role of the case manager is not to keep people in the housing, but rather help them identify the strengths and what they need to keep their housing, and then to link them to those services. Vera Beach is from Grand Rapids, Michigan. She switched from a transitional housing program and retooled to a rapid rehousing program in 2008. And she said one of the things that she trained her staff on was to say that the rapid rehousing program is, our job in the rapid rehousing program is to help you. When they would talk to their clients, they would say to them, we're here to help you overcome your barriers to your housing, to give you this subsidy, find landlords so that you can get into housing, but our program cannot keep you in your housing. It's your job to keep your housing. So we need you to think about what you need to do to keep it, and we're going to be here to help you, walk beside you as you do that. And if there's services that you need to be connected with to keep you in your housing, we're going to do that. So I think the key component in this home-based stabilization services is to really focus on what somebody needs to do to maintain their lease, really understanding what that is, paying your rent, your living arrangements, your healthy boundaries, and that the services are all focused on that, the maintaining and housing stabilization. If folks need, other types of things like, I don't know, parenting, classes, that type of thing, and that's something they want, that's something you connect them with, but your job is to really focus on what they need for housing stabilization as identified by them, client-driven. And again, it's voluntary. So remembering that we should not be exiting people from rapid rehousing programs unless they've done something to violate their lease. As long as they're living in their lease, we've heard of rapid rehousing programs that require sobriety. Well, we don't have to be sober if, as long as we're paying our rent, and so we shouldn't expect our clients to do the same thing. And then finally, it's these links to the mainstream and community resources. So if you think of the fact that every household in every community, all of us need to have a network of support systems. So if we do have a crisis, we have folks that we can fall back on. So I really want you to sort of think of the role of this rapid rehousing case management is linking folks to those different services that they need that exist out in the community. So before we turn this over to questions and answers, I just have a couple of slides here on program design. So the first thing to really think about is your policies, your program policies, and there's two key things that we talk about in the program policies. Is that your services, when you look at your policies and procedures for your program, is that services need to be voluntary, and as a provider, you should not require program participants engage in specific services that you've determined unless you're required to do so by a funding source. So an example of where that would be is under ESG, there's a requirement of a minimum of one case management contact. But how that happens or how long that is, that should all be or when it happens, that should all be client-driven, not program-driven. So what works for the client in terms of making that contact. And then the leases that program participants obtain look exactly like the lease that any other renter in the community would obtain, and I talked about that a little bit earlier. And then the other thing is there's two distinct roles in staffing. One is the housing locator housing search role, and the other one is the housing stabilization case manager. And whatever and however you want to do this, these are not traditional case manager job descriptions for shelter or transitional housing case manager. The role in rapid rehousing is very different. Some communities have one person, especially if they have limited resources, that do both. Other communities have specific housing locators that work in the housing search role, and then when somebody is housed, there's a housing stabilization case manager that kicks in. But it's just really important to know these different roles and what the skills are, and they're very different skills for each of these. So if you've got somebody that's going to do both roles, they need to be equally as adept at both roles. The housing locator role, which is really lots of people skills, understanding landlord-tenant issues, really being able to be a marketer, to leverage the housing resources, and then the housing stabilization case manager really has to be that strength-based person that can really focus on housing stability, has a lot of strong linkages to the community and knows what exists out in the community, and is a real creative thinker. And then finally, this is sort of full circle. What you measure in the program really is the essence of what rapid rehousing is. So rapid rehousing is about shortening the time people are homeless, quickly exiting people out of homelessness into permanent housing, and then reducing recidivism and keeping, helping people be in permanent housing. So these are the outcomes that programs should measure to see if you're actually doing what rapid rehousing was meant to do. So how long is it from the time somebody first becomes homeless? They're either entry onto the shelter system or moving to the streets, and this is meant in a place not meant for human habitation. The the truly street homeless, and then their exit to permanent housing. What's that length of time, and how long is it taking? And that's a sign, of a rapid rehousing program. Obviously, HUD says 30 days. Nobody should be homeless more than 30 days. But, what is that length of time, and is this truly a rapid rehousing program? And then, are people exiting to permanent housing? When the subsidy ends, are they still in permanent housing? And then 12 months after they exit, how many have become homeless again? And then finally, program efficiency, the cost. And you saw across the board that the cost is less, but if, there's a couple of programs in one community and one program has, an exit rate cost that's much lower than another program, and yet their outcomes are the same, then it's really important to look at that and think about, how do we become the most effective and efficient with our programs. It's not about providing the least amount of services to be more, to serve more people, but it's about having the right outcomes and giving the resources that people need. So this is it. To sum it up, what rapid rehousing does is reduces the length of time people are homeless. It minimizes the negative impact of homelessness on their lives, and it assists people to access the resources that can help them with their long-term goals, if they choose. But what rapid rehousing doesn't do is it doesn't eliminate poverty, it eliminates homelessness, which is huge. And it does not assure that people are going to have affordable housing. There's still going to be cost burden, but so are most poor people in your community that never become homeless. It also isn't going to protect people from the impact of life losses and bad choices, which again happens to lots of people, not just persons that were previously homeless. And I think finally, it's a thing about housing mobility. A lot of times we think if people don't stay in the housing we put them in, that means that somehow the program has failed. And in fact, people are very mobile, and it's okay to be mobile. And as long as they're not coming back into the homeless system again, understanding that just because somebody's placed in housing doesn't mean that they're not successful if they don't stay there. So I'm now going to turn this over to Stuart for some question and answer time.
Great, thank you, Kay. So we have some initial questions that were sent to us in advance that I want to pose to Kay, and she can address those, and then we're going to open it up and allow, I think at this point, Sarah Fox is going to have some questions, and then of course folks generally can ask questions. So the first question is, how can we best incorporate rapid rehousing into our system-wide response to ending homelessness? What is taking place across the country? Kay?
So I think when we think about rapid rehousing as a systemic response, we really need to stop talking about it as a program or just as a piece of what we're doing, but rather think of it as one of the key strategies to end homelessness in our community. The same, like in a crisis response system. What a good crisis response system should have is first a good front door coordinated assessment process that prioritizes it first before prioritizing prevents and diverts folks from the homeless system, and then if they need a shelter bed, gets them connected with a shelter bed. But then it's a strategy that immediately that process of helping folks find housing begins. And so it's not just a few programs doing it, but it needs to be recognized as a community-wide strategy that this is our approach to ending homelessness, using language like we are rapidly exiting people from homelessness, and really wrapping around when I talked about the definition of rapid rehousing. What does rapid mean? That starting to measure how long is it that folks are in our system, and what resources do we need to do to make that happen, and not look at it from just one funding source, but rather, if this is a strategy, what do we need to do to keep this happening? I often say, within for example, I used to run a transitional housing program years ago, and I didn't have one source of funding for that program because, when one source of funding ran out, I'd get these little grants, and then the grant would be gone. I didn't just say, well, now I'm not going to do, house anybody anymore. I'm not going to bring anybody in my program anymore. I'm going to close it down until the next round of funding happens. And we find that communities often do that with rapid rehousing. They get like a chunk of money, and then they spend it and rapidly rehouse, some households in the beginning, and take the first 30 households that come, and then they're done, and the rest of the folks just stay in the system. To really think of it systemically, you need to start really looking at where resources are being spent and the kinds of things that people need to be, the kinds of resources you need to be leveraging beyond just the traditional resources, and make it a critical intervention of your community. I think that sums it up.
Great, thank you, Kay. The next question, and I understand that we have a whole bunch of questions coming from Sarah, so we need to keep the answers brief. This one we actually have answered, which is, do individuals maintain their chronic homelessness status while in rapid rehousing? The answer is yes. The follow-up to that is, what are the implications of this practice?
So I'm not sure what, in terms of the implications. I think that, the good implication is that we can use a less intensive intervention that we find a majority of people are successful with, and the implication is that we don't have to worry that they're going to lose that status as long as they're still in the rapid rehousing program. If they're, if they're not getting towards that point of stabilization and it looks like they're going to lose their housing and not be able to exit into permanent housing, that we could go back to an earlier intervention. So it allows the opportunity to be able to use the rapid housing intervention for even folks that might be screening for permanent supportive housing if they have the chronic status.
Okay. The next question is, how have other communities reallocated and transitioned existing resources into rapid rehousing?
Okay, so there's lots of things that communities have done, and and I think a lot of communities have used the opportunity with the continuum of care NOFA to really look at all of this cost effectiveness that I showed. The cost, one of the tools, if communities want to do this, there's 2 tools on our website that I suggest you start looking at and using. One is called the Evaluator tool, and the other one is called the Performance Improvement Calculator. Data comes directly from either your point-in-time count, your AHAR reports, or your HMIS data, and you enter the data in. It can start really showing you, like, for each strategy, what are the success rates, and it can take each program that you can see across and do some comparison of programs. So, what a lot of times folks started with low-hanging fruit, where maybe there was an organization that already was like a transition-in-place program and moved to rapid rehousing very quickly because it was operating very much like rapid rehousing. Then next, looking at perhaps a scattered site rapid rehousing or transitional housing program and moving that to a rapid rehousing program. But there's some communities like Mercer County, New Jersey, which is the Trenton area, that made a decision 2 years ago that they were not going to fund any more transitional housing. They had seen such huge success rates with rapid rehousing compared to transitional housing, so they made sure everybody in the community knew, and they transitioned or reallocated all of their transitional housing money to rapid rehousing in the 2012 NOFA process. Those are just some examples.
Great, thank you, Kay. Another question is, do other communities use the SPDAT or other acuity index tools for determining how best to target case management resources for rapid rehousing clients? So,
I think, and I don't know how much there's awareness, but we know that a lot of communities are using the SPDAT, the VI SPDAT, and the FSPDAT for the purpose of prioritizing households. What I know, for example, is in West Virginia, what they've made the decision, because they don't have right now enough adequate rapid rehousing resources to rapid rehouse everybody that's scoring for rapid rehousing, so they've actually decided that they're going to put their rapid rehousing resources to the higher rapid rehousing scores, those that are, sort of borderline permanent supportive housing. And because, again, the idea is that those are the folks that have the most barriers to getting into housing, and then, looking at case management. But I think it also comes back to, regardless of somebody's score, the score, again, has to do with when people are homeless. Once people are housed, the level of case management they need can greatly vary, and it really does not depend on the score. It really doesn't measure resiliency or their resourcefulness once in housing. So I don't know that there's a really good way to measure what people need. It's more about just knowing your clients, working with them, and having a good evaluation process.
The final question, initial question before we open it up, is how do we shift community mindset from quantity of services versus quality of services in parentheses, an example of this is shallow subsidies versus providing a more targeted intervention to high barrier clients.
So I think it's the results. I mean, we talk about, what we have to do systemically is reduce the length of time people are homeless. We need to move more people, to rapid rehousing, but we also need to decrease recidivism. And so, it needs to be a combination of being effective and efficient. What are the most efficient resources? But instead of just, taking the little bit of money we have for rapid rehousing and spread it very thinly to a lot of people and then not have a lot of success rate, we'd be much better, looking at ways that we look at how much dollars and resources are going in all our strategies, and where can we start moving some dollars from some of the strategies that may not be as successful through a reallocation process, and look at where our resources are going and have more resources around a strategy that's going to have a lot more impact. But this needs to be client-driven, because it's not just about serving the most people, it's about also the success rate at the end, those that can keep their permanent housing and not become homeless again. So it has to be both.
Great. Now we're going to open it up to general questions. There are a couple ways to get your questions to us. The first way is to, if you're in the same room as Sarah Fox, to give the question to her. And if you're not in the same room, then there is on the side panel, there's the ability to type in a question. I will be able to see that, and we will try to get to all the questions that we can by the end of the webinar. So I'm going to now unmute Sarah to pose some questions to Kay.
Okay, the first question that I have is, to what extent did the programs mentioned focus on employment strategies?
So, Sarah, are you talking about some of the programs I talked about, like Hennepin and Alameda?
Yes, I am.
Some of those communities. So, so specifically what I'm going to say is that when I talked about the communities, it was community-wide. It wasn't about a specific program. So I think there were different levels of that. One of the things that part of we talked about that follow-up case management, and if you remember, and I don't know, I actually went through that slide pretty quickly, but we said, there's you have your household, and then you need to make these connections with the community resources. So, but what we found is that, well, in fact, this is not one of those programs, but another program that I know about that is doing, went from transitional housing to 100% rapid rehousing in Virginia. They initially had what they called an employment specialist, and they just thought that was really going to be important to help people get employment and find jobs in rapid rehousing, especially when they started really focusing on targeting singles that had very low or no incomes. And what they really discovered, that role has become much more important in helping people connect with what already exists in the community, that it was not effective in trying to just do it, but rather, again, so that if somebody down the road, has an issue with a job, now they're connected with that larger whole. So they've really worked on developing community partnerships and doing that. So it's not that the program itself has to do all the employment stuff, but that role of almost brokerage, the case manager has to be a broker and create those partnerships. So it's not, and again, I wouldn't suggest you need to do it from a programmatic approach, but really as a system, and as you look at system change, how do we bring employment partners that can partner with us across all strategies, not just rapid rehousing? Does that help?
Very helpful. Does anyone else have a question on top of that, or we're good? So the next question is, if rapid rehousing resources are limited, how do you suggest prioritization? Would it be either for the chronic population or those in transitional housing, or transitional homeless, sorry?
So when you say transitionally homeless, meaning what?
So I didn't write this question, and the person who did just stepped out, I just noticed. But I believe it's for people who would bounce back out of homelessness easily. People in shelters.
So people that are in shelter population. So, again, one of the things I said before, and this is a really tough one, right? Because, okay, so there's limited resources. And so we do need to prioritize those that that have the highest need in terms of rapid rehousing. And, I think part of this is, okay, so when we're looking at, your 100-day initiative, then we may be looking at more of the chronically homeless population and how can we use rapid rehousing with that population. The hardest part is this idea of limited resources. And what I tend to try to challenge communities rather than say, well, this is all the money we have, so this is what we're going to focus on, is how do we take a strategy and make it larger? How do we start really increasing the resources and keep that dialogue going? And in the interim, again, trying to, with each household, make it individualized and create that plan around their individual needs. There's not a good, you can sort of hear from my voice, I wish there'd be a pat answer in this. It's very difficult to come up with the right answer. I think it's, looking at your system, what are the needs in your system, where do the needs lie, where are the chronic homeless numbers versus the non-chronic numbers. One of the things that we really, HUD's really looking at, and through Opening Doors, is ending, as you know, ending chronic homelessness. By the end of 2015, they're sort of starting to edge that up to 2016 right now. So, we do know there's communities that are starting to really look at resources there now, and knowing that once that number gets closer to zero, that's going to free up a ton more resources to start working with the other populations. Mm-hmm. But either way, even if you're working with the transitionally homeless, I would try to work with those that are going to have the higher housing barriers and have more difficulty finding housing on their own, and those that have been in the system the longest. Okay. Because that length of stay is one of the things that you're going to have to start measuring across the system for the purposes of HUD. It's a systemic measurement, so how do we start decreasing that length of stay, which is looking at all of our populations.
Thank you for that. In Salt Lake City, where did the money come from for the rapid rehousing, and did it come through reallocation or from new funding sources?
So, okay, well, that's a good question, and I didn't include it, again, because of the time. So Salt Lake City, they started with HPRP, and then they partnered with TANF. They also used local resources, they used private dollars, and they used state resources. What they did is just, this was not about one source of funding, and that's the one thing I maybe didn't say earlier when the question came up about how do we make this more of a systemic strategy, is that this is not about looking at just like one funding source. It's about all of those. It's about identifying new funding streams. It's about looking at where our current resources are going and reallocating resources, and it's about even looking at local, state and local funds that have gone to similar types of things, but can we use them more effectively? And even sometimes it's poor performing programs to higher performing programs. But I think you have to look at all of those. Reallocation is going to be critical to increase rapid rehousing. Really looking at where our resources go and putting the limited resources you have towards the most effective strategies, which in most communities, rapid rehousing is being shown to be that, but also leveraging those new resources to increase that capacity. So it's both.
Thank you. Is there any research that identifies what the predictors are for success in rapid rehousing?
Nope. There's no such thing. I say that tongue-in-cheek. But there is just no, that's what we talk about. There's no measurement for client resiliency. There's just, we tried to do it through assessment tools and find all those, like what we thought those predictors were, and we haven't been able to do it. And what I would say is if somebody does, we're all going to be like grasping at it, because that's been one of the hardest things, is that everybody has tried to come up with like this some kind of scale or formula that we can see who's going to be successful. But that's what I talked about throughout this presentation, is that we have not found any assessment, any measurement, any predictor scale that can predict success in rapid rehousing. Part of that is that there's just people that are more tenacious and more resilient, and just people that you just wouldn't expect to make it because on paper they don't assess well, suddenly are doing like amazingly well. And I think again it's back to that stuff I talked about Maslow's hierarchy of need, is that prior to stabilization it's hard to predict what people are going to be like once they have those basic survival needs met of having stable housing. And so when people are not stabilized, where they scale out is going to look very different than once they're stabilized. So we just have to go with the housing and go from there.
Thank you. What are the outcomes specifically for those with zero or very little income?
So the one I showed you, right, that I go back to this, oh, look at me trying to go back and it's not going back, but see if I can get back to this slide. So this is the slide. This is one of the best studies that shows the outcomes for those with no income. So what you can see here is and this was specific to the SSVF program, but what they found is that 73% of those that came into the program with no income exited into permanent housing. So 3/4 of the persons that came in with no income exited into permanent housing. And then, you can see across the board. So, in fact, high success rates, because once persons got into housing with no income, but that's where you need the flexible program, then they started doing the work to get income so they could maintain it. So this is where you can't just, this is why the one-size-fits-all program doesn't work, where we're just going to give you 2 months subsidy and then you're on your own. It's about, individualizing it, and because everybody may need a different period of time in which to find their income. And the other thing is, once people are in housing, and I know we had this discussion, Sarah, about, sort of the, answers to, do you have enough, enough to cover your housing costs, or I can't remember what the question was, but then also when it comes to reporting income. And, what's interesting is that, we can put stuff on paper about what works and what doesn't work, but it's just sort of has always amazed us at how once people are in housing, they're just able to figure out how to, pay bills in ways that on the paper that I put down and what I put down doesn't work. But, whether it's, borrowing from friends or, finding other ways to do it, it's just very creative. Again, when you're looking at people with no income that are at most might be able to just get a subsidy, or not a subsidy, a fixed income like SSI or SSDI once they're housed. It's really important then at the front end also to think about what that housing would look like, and that's where you really, especially with singles, want to start looking at shared housing, or even with families, where you're looking at a unit that might have shared housing to be able to get, to make the resources stretch further. It also helps even with families. It helps people have more of a support system. One of the hardest parts about single parenting is being on your own, right? And, if you can bring, 2 households together that really connect well, they can really sometimes give each other a lot of support. The same thing our families do, right? If somebody in our family had a crisis, we wouldn't, say go to a homeless shelter. We would say, like whether it's an emotional crisis or financial crisis, how do we make this work out? How do we pool our resources to make it be successful? And we just need to think about rapid rehousing in the same way. If somebody has no income, what can we expect them to do, and how do they start looking at being really creative in the resources to keep their housing?
Okay, Kay, we have a couple of questions pertaining to this slide. Instead of the percentage of outcomes for those with no income, what is the actual number of individuals identified in this study? So what's the actual number? Okay.
Yeah, the total number. I don't have that, so that's something I can send to you later. We'll get that and get that information out to you later. Stuart, do you want to just make a note of that we'll get information on that from our research department? This came from the National Center on Homelessness and Among Vets, and it's a whole big report, and so we just pulled a couple slides out, but we can get the actual numbers.
Okay, and the other question pertaining to this is, does this number and these percentages reflect both the chronic and non-chronic population?
It was everybody. If you look at the bottom, the total number of people it represents is 22,086, but I don't know what percent of each of these. See this number? So it was a huge pool of folks they looked at, but I don't know, how many of those were. But it also, yes, it would include those that would fit the chronic definition as well.
And do you know, or is there a way to pull from that research exactly how many chronically homeless received this intervention and had a successful and positive exit? Like out of the total number?
how many were actually chronically homeless. You know, I think what maybe the best thing we'll do is just send you the link to the study, and then you'll have that. And again, you know, this was just what they were trying to do was really compare the SSVF intervention against the deeper interventions that the VA, you know, provided, like the GPD and the VASH. In this. And so this was not specifically, I think, targeted around the chronic homelessness, but I think, you know, one of the best things I would do, again, is encourage you to talk to Megan Cotter with Micah Ministries. We can get that contact information because, you know, they specifically targeted chronically homeless with their community. And the numbers, do you know what your point in time count is total and how many of those are chronically homeless for the New Haven area?
We have around 125 chronically homeless.
Out of a total of how many?
Oh, I can't remember. On the single side, 550. On the single side, it's around 550.
So about 20%
Mm-hmm.
of the total. Okay. So I think that I think Fredericksburg's numbers are lower than that, but nonetheless, they've just been extremely, and their housing costs are so incredibly high there, so it just makes it, you know, where an efficiency can go for $1,400 a month. So it just makes it, and I don't know what your housing costs are in New Haven, but that's just one more challenge they deal with is the high housing costs in light of that. But they've still just, you know, the Micah Ministries has just totally used it for the chronically homeless population. And in fact, I mean, they're just really looking at that from that continuum of care. The Fredericksburg continuum of care is just really ramping up rapid rehousing as a systemic strategy.
Well, thank you for that answer. My next question is, what are the non-permanent exits? So on this slide, what does non-permanent housing exits mean?
On this one, so they, in other words, and remember I said that most of these were temporary situations where they left the permanent housing and maybe went to live with family and friends.
Mm-hmm.
So we didn't say they exited to homelessness because only 2% of this total, of this 22,000, only 2% exited to homelessness. And they found the majority of these exits they weren't in the permanent housing placement anymore, but they had moved to like a temporary situation where now they've moved in with family and friends, but they weren't back out in the streets or in an emergency shelter.
Thank you.
That's what non-permanent means.
Thank you for that. Our next question is, how do our clients not lose chronic status if they use rapid rehousing dollars to move into permanent housing?
So we've actually talked about that twice.
Yes.
And that's there is just under the guidance from HUD, and it includes VASH, or the, you know, veteran programs, the SSVF programs, and rapid rehousing, both through ESG and continuum of care, is that the guidance is that as long as somebody is in the rapid rehousing program, they do not lose their chronic status. And so it would just need to mean, you know, just a documentation of that within your HMIS system, so that, and as long as they're receiving the rapid rehousing services, they do not lose that designation as chronically homeless. And they can stay, you know, on the waiting list or be eligible for their, you know, whatever permanent housing that they would screen for as a chronically homeless person. So I have a couple of other questions right now, and that is that, you know, one of the things, again, just to talk a little bit more about this concept of rapid and really, you know, with whatever resources you have, and I want to go back to the main, you know, definition of what does it mean to rapidly rehouse people. And it really is about looking at the length of time, and this is not about using, you know, our rapid rehousing resources to house somebody after they've completed so much time in a program, or, you know, our completed transitional housing program. We've always looked for resources to house our people, and, you know, I've been a provider, was a provider for years in the community, and, you know, we were always looking to leverage resources once our folks completed our program to help them move to housing. And we know that there's a lot of folks that are using the rapid rehousing dollars in much the same way, and that's not a rapid rehousing strategy, and that's not going to create any community change. And in fact, communities that do that are not seeing improvements in reducing homelessness in their communities. They're not seeing the length of stay going down. They're not seeing their numbers come down, and it's just they're not having the success rates. And it's really, I mean, all of this stuff needs to be measured by, what are our system changes? If we haven't been able to see the systemic changes we've needed by using our resources for emergency shelter, transitional housing. The resources that have been out there, have not been successful in reducing homelessness because we've been doing that stuff for years. That's the stuff I used to do, and all of you are still doing, and we just weren't seeing an impact. In fact, our homeless numbers in the community I was in kept going up, and so we'd add more shelters, and it kept going up, and until we switched to a rapid exit strategy back in 2005, and even for the first 2 years after that, between 2005 and 2007, we still saw our numbers continue to tweak up a little bit, but finally when we kicked it in as a community-wide approach, that this is where we were headed, and this is going to be the primary response to homelessness is a rapid rehousing approach across the board. We saw our numbers start coming down, even in the midst of the early recession. When we did our point-in-time count right after HPRP came out, we put our HPRP dollars right towards rapid rehousing and just increased all of our efforts around that. And we saw the biggest decrease in homelessness. It actually took us 5 months to report our numbers, and we went to every single provider and we looked at all of our street numbers and triple and quadruple counted to make sure that we had it right, because it was such a dramatic decrease. We had an overall decrease of 22% in homelessness in that 1 year, just by really targeting our resources in the right way. And that was the beginning of really shifting that. And so it is about rapid rehousing dollars and resources need to be used to rapidly rehouse people quickly at the front door and give them the resources that they need to have. So I think, the one thing I say when I do the training that I just want to bring up is that I think the thing that hits me is that, when it comes to rapid rehousing, I often get a lot of questions about people sort of challenging the results that we see, the research that has come out, the impact that communities have seen in terms of the numbers I showed you on those slides, earlier about what we saw, and we looked at, again, every community we looked at had the same numbers no matter where we went. This was just communities that were asking us to come in and do training. We said, give us our data. They had never looked at their data. And my community had one of those trainings, this was when I was still doing my community work before I was at the Alliance, did a session the same time that Alameda, California did. And the really interesting thing was that, I didn't see anything in Lancaster County, Pennsylvania looking anywhere similar to Alameda County. I mean, first of all, we have rural areas in our community where it's really hard to find services. We just felt like we were very unique and different. And then Alameda saw that their costs, are way higher. They had extremely high housing costs in the Oakland, California area. What was so interesting is when you look at their data and you looked at our data, there was almost no differences. It was probably an aha moment, and I didn't know Elaine at the time at all, because I was still working at the community level, but we still talk about that, how that caught us off guard, that we weren't as unique and different as we all thought we were, that when you start looking at data, your own data, your data tells the story. And, and even, so looking at your data, pull your data, and I just did some clinics throughout the entire state of Virginia, and we pulled the data for 14 continuums of care, and across the board, the data, no matter which community you went to, using those tools I talked about, showed the same data that you have that I showed in the slides, very similar trends. It wasn't number for number, but the same trends, that rapid rehousing still has better outcomes than the other strategies. Lower cost rate, higher success rate for permanent housing, and less recidivism rate. And what's interesting is that when you look at the shelter, the rates of recidivism with emergency shelter and transitional housing, we've always known that not everybody is successful in those strategies. And so we tend to focus on the folks that are not successful in rapid rehousing, even though the majority are. But when we talk about our transitional housing programs and emergency shelter programs, when I go out and talk about how great my transitional housing program was, I never talked about the people that didn't make it in my program. And there was a ton of people that didn't make it. We were a pretty good program, but we had about a 78% success rate when I was there the first year, and it went up to 85%. But that was still like 15% and, 20-some% that didn't make it. I never talked about those cases. I talked about the successes. But sometimes when we are talking about rapid rehousing, we focus on those few cases that don't make it, and we forget to focus on the tons of folks that are successful. And so I just encourage communities to start really looking at the success, and because success breeds success, and we need to wrap ourselves around how successful this has been and the difference it makes for those families that are in their own housing. So I think that sort of addresses, there was a question about, okay, so then the next question was specific data on how this model has worked with youth as well as with children. So I don't know that we have any specific data, and I'm looking at Stuart. Stuart, do you know of anything off the top? So that's another thing, and I can get that. Well, you know, Sarah, if we find some data specific to that, what we, particularly for youth under the, you know, youth with children, one of the things I did recently hear from Hennepin County is that they're finding that the younger families sometimes struggle more. So what they're trying to do, not that they're not successful, but they're just trying to look at how you know, think about the model when you're working with that younger population. One of the things we've also heard from other communities is when working with that younger population and those with children, the, you know, the 18 to 25-year-olds and those with children. And by the way, I'll just say that, you know, I was under 25 when I had my kids, you know, and when I see this, you know, we talk about youth with children, you know, and being young, and I'm thinking, gosh, I had both my kids before I was 25, and I didn't, like, look at myself as a youth at that time. But, you know, specifically to single parenting, I actually ended up being a single parent at the age of 25 with 2 children. And what helped me get through that was my support system and my support network. And having that, you know, support network that could help me through those rough times. And so I think that's the piece we need to look at when we're using rapid rehousing with this population, is it's not just about the rapid rehousing money, but once these younger folks are housed, how do we connect them with a support network that can be there? You know, and this is thinking outside the box of traditional social work approaches in terms of the, you know, providers that are out there, but rather like, can we connect them with the faith community or other community support systems or mentoring that can really give them that, those connections that, you know, because as a single parent, it's really tough making it, particularly when you're a young single parent. And so it's sort of the same thing we would do for our own families again. How do we take our own situations and our own lives and apply the rapid rehousing model? So I think I covered, I don't have any research on that, but that's just coming from stuff we've heard from communities. Any other questions? We have about 14 minutes, so we have time for maybe 2 more questions till we wrap up.
I do have a couple more.
Okay. Shoot.
Okay, so I'm going to go on a little different route. People with severe and persistent mental illness generally do not have support from their families, especially financial support. Where will they get the money to pay for their apartment? If someone with severe and persistent mental illness uses rapid rehousing, how can they maintain that housing placement?
So I think, and I'm not sure where that question's coming from, but I mean the research that we've seen is that when somebody becomes homeless, if they have, you know, that somebody with severe and persistent mental illness, once they become homeless, just exasperates the mental illness. But in fact, the majority of people with persistent mental illness don't become homeless. That in fact, you know, many people have severe mental illness. Again, back in our, you know, our own family systems, and so it's a matter of, you know, when somebody does become homeless, then it just can often exasperate the mental illness. And in fact, this goes back to the Housing First model that Pathways, you know, has identified, is that those with severe and mental illness, once they're in house, you know, stabilized in their housing, can often become more stable in their mental illness, and other support systems can be built for them. So, you know,
and I think, sorry, Kate. There's no disputing the outcomes that Housing First works for this population. Mm-hmm. I think what the reality of what's happening in New Haven and across the state is that there is a very large amount of individuals who live with a mental health disability who are homeless in this city and in our surrounding towns. And is this an effective intervention for them?
So the important thing will be, if it's going to be effective, is, again, connecting them with those support systems that they need to get involved with. So this is not about just placing in housing. Again, this is not about placing in housing with just a short-term subsidy and then walking away, right? That's why that housing stabilization case management is a core component. And that position in working with these families is critical in helping with the success of these families. What are those services they need to be connected with? How do we get that support system in there? How do we leverage the peer support and those, I mean, most communities have, mental health peer groups that once we know where somebody is and somebody's stabilized, we can get them connected with the services they need to benefit from some of those. Sometimes there's, the day centers that folks can participate in, but as long as people are on the streets, it's really hard to engage them in those services. And so, I mean, we just know that for folks that have mental illness, that once somebody is stably housed, they have a better opportunity to address those needs and for it to get better. But it doesn't happen by just putting somebody in housing. And I think that's the piece that people need to continue, that we all need to continue to remember, is that that's why that follow-up case management is a critical core component, because it's sort of like the same. I often used to say, it's the same services that we would want to get somebody surrounded with in the formal model of transitional housing, right? You come into transitional housing, then while you were in our transitional housing, we'd get you all these services and get you connected with stuff to get you ready for housing. So when I used to work with my staff, I'd say, we're going to do the very same stuff that we did in our transitional housing program, but we're going to do it with people once they're in their permanent housing. Those same services need to be leveraged. We need to do the same stuff, but people are in their own housing and not in a temporary housing situation.
So I think one of the concerns that is around the room is that we have very limited case management services in the surrounding area, and I guess, and I know what you're going to say, but so that's sort of bubbling
up
what I'm going to say. I have a good idea, yeah.
Go ahead.
What?
Sarah?
Say it again.
Go ahead.
So what is your response when a community has limited case management to provide to this population?
So I think that this is, again, when we start really looking at if rapid rehousing is going to be a critical intervention, one of the key interventions in our community. This is where we have to continue to look at where our resources are going and make sure that, rapid rehousing as an intervention has the right things that it needs to be successful. It needs to have all the core elements. So just like, within a shelter environment, we would want to make sure that we have, the right component of case management staff to deliver the service. We have to figure out a way to do that. And so this is I think this is part of a larger community conversation about, where do we start shifting our resources? Where is our pie being cut up? How much of our dollars are going to rapid rehousing versus all of our other interventions? Where can we start shifting our resources and reallocating resources so that our resource allocation plan is better aligned with what we need in our community and and aligned with the success rates? So I agree. I mean, you can't do effective rapid rehousing if there's not a community commitment that this is going to be a major strategy, and we're going to put the commitment behind all of those resources. And again, just and this is thinking creatively, and and I actually, it just so happens that it's the same community that I talked about with Micah Ministries, but Fredericksburg, we did a rapid rehousing challenge in Virginia, and we said, and the challenge was about, like, there's no more money coming your way, but if you start really looking and trying to think of rapid rehousing as a systemic strategy, how many households can you rapidly rehouse over 100 days? So it was this challenge that folks took on, and it was going into the holiday season, and just this one community decided, it was the Fredericksburg Continuum of Care, all the providers got together and they decided, instead of the traditional adopt a family in the shelters, and families get these great Christmases while they're in shelters or transitional housing, or the singles and individuals, across their system they did a Home for the Holidays campaign, and asked everybody, instead of contributing to these Christmas gifts for folks, to instead help everybody find a home for the holidays. And it was a huge community impact that they got media over and raised a ton of money that allowed them to then be really creative in rapid rehousing. So they, because every funding source comes with certain guidelines, right, around ESG or SSVF or continuum of care. They all have little tweaks, but it was about taking rapid rehousing to scale and they just stopped thinking of it as just what we can do with these little bit of funding sources, but rather how do we start really thinking what we need to do as a community to expand the strategy. And it just built momentum, and they are continuing to do that. So, they're doing a ton more rapid rehousing than they would ever be able to do if they look at those, given resources that come in just to do rapid rehousing, but by having a community approach to it. So that's just a way to start really thinking about it, and how do we get people to start thinking differently, because you do need to have that case management as part of the approach. And I think we have probably time for one question, Stuart. I took over your role here. All right, so time for one more question, and then we'll finish up.
I do have one more question, if it's possible.
Sure.
With rapid rehousing funders generally have proof of sustainability as criteria. How do you overcome this funding barrier?
Well, so I think you need to talk with your funder, because so if it's pass-through money, I mean, for example, neither continuum of care or ESG require proof of sustainability. In the early days of HPRP, sustainability was one of the factors, and they threw it out within the first 6 months and changed the regulations. So the regs do not require any proof of sustainability. So if local funders are using that, then there needs to be some advocacy to change that, because that is not a requirement from any of the federal funding sources or any pass-through money, federal pass-through money like ESG that comes, through the state to the local level. So sustainability is not a criteria from any of the federal funding sources.
Okay. All right. Well, thank you so much on this end.
Okay. So, I really, again, want to thank you all. I know in this busy time, especially in the summer, and it's a Friday afternoon, to take 2 hours out of it. And I don't know what your weather is like there, but it's amazingly beautiful here with low humidity, and we're not dying from the heat here in D.C., but to take 2 hours out of your incredibly busy schedules. I want to say that to all of you that are working in this, we get how hard this is. Like, you guys have a huge job, and I know sometimes we do, the webinars and the training, and it can sort of feel like, okay, it's easy to talk about this stuff, but, we're here trying to figure all this out, and I really recognize that. I've been where you're at, both at the provider level, and then I was running a local continuum of care and a coalition before I came to the Alliance, and you have incredibly tough jobs, and you're also incredibly resilient and continue to do this, and I just wish you success in your 100-day initiative and your the Rapid Results Initiative, and if there's anything we can do to help, please let us know. If you have further questions on this last slide, you'll see my email address, and you also see our website, which is endhomelessness.org.